I became a statistic today, a mortality statistic. No, it wasn't a car accident or a stroke. It happened right here in the hospital. Inexperience killed me. And it wasn't the wrong medication or a botched procedure. I was the victim of faulty delegation. The mistake had nothing to do with poor technique, but it was lethal nonetheless.
Delegation, done effectively, is one of the most powerful tools a nurse can use. But faulty delegation can spell disaster for the nurse, the client, and the employer. Welcome to our program, Delegating Effectively, working through and with assistive personnel. This is the third in our series on professional challenges, and it explores the vital role of delegation in today's healthcare environment. In this video, we'll follow the story of Mrs. Campbell. As her story unfolds, you'll get a first-hand look at how critical the skill of delegation can be. Throughout the story, a red flag will appear on the screen when an important step in the delegation process has been breached. Then, Vicki Sheets, a nurse attorney and director of practice and regulation for the National Council of State Boards of Nursing, will comment on where the problem occurred and why. Delegation is a double-edged sword. While you can accomplish much more working through others than you can do alone, there are some inherent risks and liabilities whenever you delegate. Preparation is the best prevention, and yet many nurses today still do not feel adequately prepared to delegate.
My assessment of new graduates' ability to use delegation is that it's poor. It's not a strong component of nursing education, and it sometimes is a difficult tool for them to be able to do, especially in the initial probably first 6 months. The problem is the disconnect between the theory and the actual practice, the ability to use the theory in their clinical rotations as they spend time as a student before they actually become the graduate nurse or the nurse.
Delegation is the process of transferring to a competent individual the authority to perform specific nursing tasks in a specific situation. These assisted personnel are usually unlicensed staff members. In most states, they're listed on a registry. In some states, they're certified, and in only a few states, they're licensed. These helpers may be referred to as nursing assistants, nursing aides, or patient care technicians, but regardless of the title, they're not nurses and are not authorized to practice nursing. Their authority to perform nursing tasks comes from the licensed nurse through the process of delegation. Delegation is built on mutual trust and respect. Each party is dependent on the other. The nurse depends on the assistant's skills in performing the assigned task, and the assistant depends on the nurse's availability and guidance. It is a symbiotic relationship.
We can't do our job without them, and they can't do their job without us. We are their eyes, ears for the patient.
Nurses don't own delegation. It is a universal process used in the business world. But because of the critical nature of nursing practice, delegation in nursing is addressed in most nurse practice acts. Delegation in nursing is a legal as well as a managerial act.
Delegation is a skill, and like any skill, in order to become proficient, you have to practice. It may come easy to some, and others may struggle with it. Unfortunately, many nurses are thrust into the role of delegator without adequate preparation and experience.
As a nursing student, you actually do everything yourself. You're taught to get 1 or 2 patients. Not only do you give the medications, but you do the complete care of that patient, so you don't really have to delegate to your ancillary staff.
I hadn't been in charge that many times, but it wasn't that difficult. I mean, you just make out the assignments based on the patients you have with the staff that's available. That shift, we were short-staffed, just myself, an LPN, and 2 nursing assistants, Ruth and Michaela. Since we were so short-staffed, I gave the hardest patients to myself and to the LPN, Jenny.
This is the first sign of a potential breakdown in the delegation process. Delegation is more than handing out assignments. The delegating nurse must understand the importance of the process and allow enough time to complete all the steps. Skipping steps or scrimping on them is a recipe for disaster.
Delegation is not abdication. Nurses are responsible to provide nursing care designed to meet their clients' needs. Sometimes they delegate, and sometimes they choose to perform the care themselves. Regardless of who delivers the care, the licensed nurse remains accountable for completing the work and for achieving the desired client outcomes. Being accountable means being answerable for the actions or omissions of self or others within the context of delegation. Assisted personnel are accountable for the decision to accept a delegated task and for their performance of that task. They're accountable to themselves, the delegating nurse, and their employer. Nurses have multiple levels of accountability. There's accountability for the delegation decision itself, as well as for the task that was delegated and for the outcomes of that task. In addition, nurses are accountable to themselves, the clients entrusted to their care, the employer, the licensing board, and the nursing profession as a whole for their actions taken or omitted as a nursing professional. In some states, delegation refers only to unlicensed personnel. Licensed individuals practice within a legal scope of practice for which they're accountable. When a nurse delegates to an unlicensed person, there is the expectation of additional scrutiny to verify that there is a match between the client's needs and the ability of the assistant to meet those needs.
The nursing assistants were always so helpful, especially Ruth, and they were generally very capable of meeting my needs. But tonight would be different.
I can't believe that Linda called in sick again. I know that stomach flu is going around, but without her, we are going to be very short-staffed.
I know what you mean. The last 3 days, I've been pulled to 5 West. I hope I don't get pulled again tonight.
Well, I don't see how that could possibly happen. We barely have enough people here to cover our own patients. I'm going to have to be in charge and take patients. Here's your assignment. Now, Ruth, here's your task list. Mrs. Campbell is still very weak, but she's getting stronger every day. Since she's so sedentary, the doc...
I need to talk to you right away. And Wanda's waiting for you to do a narcotics count. She's got to get home, her kid's sick.
Okay. Ruth, look this over and see if you have any questions. If you do, we can discuss them after I get back from counting narcotics.
What Karen was going to say, just as she was interrupted, was that the doctor had started me on a blood thinner, so I wouldn't get blood clots in my legs. But she never finished her sentence, and then she simply got too busy.
Delegation is not task assignment. It's much more. Delegation is a problem-solving process, just like the nursing process, and just like the nursing process, it can break down at any point.
It usually isn't just one mistake that causes the problem in delegation. Generally, a mistake in one of the steps initiates a downward spiral, sort of like the domino effect. The good news, however, is that the spiral can be halted with early identification. Better yet, it can be prevented by following the steps in the delegation process.
The nursing process involves assessment, planning, implementation, and evaluation. The delegation process involves assessment, delegation, monitoring, and evaluation. Assessment is the first step. It provides the foundation for effective implementation. Without this step, there can be no delegation. Assessment is driven by the 5 rights: the right task, the right circumstance, the right person, the right direction and communication, and the right supervision. Let's look at each of these components individually. Can the task be delegated safely? Certain functions cannot be delegated. These include client assessment, evaluation, client family education, nursing care, planning, and nursing judgment. Judgment is the intellectual process that the nurse exercises in forming an opinion and reaching a clinical decision based upon analysis of the evidence or data. For example, an assistant may act as a nurse's eyes and ears and collect observational data from the client, such as vital signs. However, it is the nurse who determines whether the client has a fever, what intervention, if any, is required, and if the physician should be notified. The part of the nursing process that is delegated most frequently is intervention. For example, when a client has a fever, the assistant may be assigned the task of giving the client a sponge bath and encouraging the client to drink a certain amount of fluids during the shift. What is the client's condition, and how frequently is it changing?
You know, I wasn't really that sick. I had been admitted because my doctor had adjusted my thyroid medication, and I was having a problem with fatigue and weakness. I was stable, but still a little wobbly on my feet.
Along with the client's condition, the nurse needs to assess whether the required resources are available to provide the needed care. Andrew Carnegie once said, "The secret of success is not in doing your own work, but in recognizing the right man to do it." Is an assistant the right level of personnel to perform the task? Frequently, the answer to this question depends on the complexity of the procedure and the technology involved in the task. Many times in making assignments, the nurse takes a share the wealth approach, assigning clients so that there is equity in the workload rather than focusing on priorities of care and client outcomes.
I can't believe you assigned me Mr. Ringwald, Mrs. Jones, and Mr. Lawson, in addition to all the other patients you gave me. Mr. Ringwald is incontinent. He's got diarrhea from a tube feeding. I'll never get out of that room. I have the toughest patient load. I think Ruth should handle Mr. Ringwald, especially since I have so many treatments to do.
Let me see the assignment. Okay, Ruth can help you with Mr. Ringwald, but you're going to have to help me supervise her. I've got my own patient load, and I'm in charge. You know how you have that little voice in your head that tells you when you shouldn't do something? Well, I didn't feel right about the decision, but I didn't know what to do. I didn't want to make any enemies, not tonight. I couldn't afford a conflict. I needed all the help I could get.
Allowing another team member to have undue influence in your decision-making undermines the delegation process. Decisions should be based on the client needs, not a staff member's dissatisfaction with an assignment. A nurse should pay attention to his or her dis-ease. If you're uncomfortable with a decision or a situation, it should be reassessed.
Can the nurse provide the assistant with appropriate direction and communication? Effective delegation requires clear, concise, correct, and complete communication. Communicate directly the expectations regarding the task, who will do what by when, and how, where, and why it will be done. The nurse provides directions which may include priority of activity, expected timelines, guidelines for consulting with the nurse mid-activity, reportable conditions, and guidelines for reporting the completion of the task and its outcomes. The nurse also clarifies his/her role as a delegator and supervisor of the task.
What will facilitate better communication between the nurse and the nursing assistant? We have here at Sinai the morning report, and the nursing texts are included. Some places I've worked, they're not included, and that's really very hard. That causes a segregation of techs and nurses. But when you come together in the morning, if you have any kind of difficulty, I believe that that's where you can, you can voice, whatever problem you may be having with a patient or with a situation.
The importance of clearly articulating expectations both for performance of the task and the expected client outcomes cannot be overemphasized. Is a nurse available to provide the supervision and assistance needed to complete the task? Supervision is the monitoring of performance of the task and the provision of guidance or direction, evaluation, and follow-up by the licensed nurse for the process and the outcomes of the delegated task. It may be direct or indirect, continuous or intermittent. The degree of supervision required is determined after assessing the stability of the client, the training and capabilities of the assistant, the nature of the nursing task, and the proximity and availability of a qualified licensed nurse.
Karen just couldn't be there for Ruth that evening. She was the charge nurse, caring for her own patients, doing treatments. And did I mention those 2 new admissions? Well, it didn't appear to be a problem initially. But as circumstances changed, it would become a significant factor.
Problems occur when the nurse assumes too many responsibilities. This doesn't leave time for monitoring performance of the task and providing the guidance and direction an assistant needs. Anytime you do a task that someone else can do, you keep yourself from a task that only you can do.
The next step in the delegation process is the actual delegation itself. This involves informing the assistant about the task to be delegated, reaching mutual agreement about the task to be performed, and transferring the authority to perform the task. Once you've determined that the task is appropriate for the assistive level, you must delegate the task to an individual who is capable of performing it safely. The effective delegator assigns tasks consistent with the individual's scope of practice.
Scope of practice is defined by the Nurse Practice Act in each state. Standards of nursing practice, such as those written by the American Nurses Association and other specialty nursing organizations, as well as the policies and job descriptions of the employing institution, also help to guide delegation decisions. The underlying premise of safe delegation is ensuring the competency of the assistant. Even if the task is written within the scope of the person's job description, the individual may not be competent to perform the task safely and accurately.
Many organizations require a competency checklist that assures that the individual's competency in specific areas has been validated. When in doubt, refer to the individual's competency checklist before delegating a task. You are only as strong as your assistant's weakest skill. When working with assistive personnel, it is important to remember their role. Assistant. That means they can contribute to the care provided, but the nurse can't just hand off a client to them. Thought needs to go into what parts of the client's care are appropriate for the assistant to perform and what must be reserved for the nurse. All registered nurses can delegate. However, whether or not LPN or LVNs can delegate varies from state to state. Assistive personnel cannot delegate.
Dana, I'm swamped. I've already cleaned Mr. Ringwald up twice, and here we go again. It looks like I'm going to be in this room all evening. I haven't even had a chance to check on Mrs. C. Could you do it for me?
Sure thing. How are you doing, Mrs. C?
Oh, I'm fine, dear, but can you help me to the bathroom?
Just a minute. Let me go get your nurse.
Oh, I can't wait. Please just give me a hand. I can't make it on my own.
Mrs. C, I'm only a volunteer. I'm not really supposed to do that. Let me go get your nurse. Just wait a minute. Ruth, Mrs. C has to go to the bathroom. Can you help her?
I'm in the middle of a mess right now. Can you take her?
I'm not supposed to.
Please, just this once. It'll be okay. Just stay next to her to steady her. She'll be fine. She doesn't need a lot of help.
Delegation is between the nurse and the assistant. It stops there. The assistant is not authorized to redelegate to someone else.
I really had to go to the bathroom. That nice little girl came to help me, but she told me not to get up without her. I waited, but she didn't come back. To tell you the truth, my bottom was getting numb. Well, I thought I could make it back to my bed on my own. And the last thing I remember, I was reaching for my walker.
The next step in the delegation process is the monitoring phase. This step involves monitoring the actual performance of the task and providing guidance and redirection as needed. This is the area that can be the most troublesome in the delegation process. We delegate the task, we define expectations, and we send assistants off on their merry way to complete the tasks. We have every intention of supervising them. However, we get busy. Time slips by, and before you know it, the shift is over, and we've yet to touch base with them. Or we monitor the process, but do not reconfirm that the assistant is capable of taking care of the changing needs of the client. The assistant gets in over his or her head, and we fail to recognize the potential harm to the client. This is skating on professional thin ice.
Initially, I wasn't overwhelmed, but by the time Mr. Ringwald had soiled himself for the third time, I was up to my elbows in a big mess, and in more ways than one. So I asked a volunteer to check on Mrs. Campbell. I didn't think it would be a problem. Then I heard a loud thunk. When I got to her room, she was in the bathroom on the floor. Mrs. Campbell, are you all right? Help! Anybody, help!
What's the problem? Oh my God, what happened?
Well, I don't know, dear. One moment I was on the john, and the next thing I knew, whoops, I was on the floor.
Go get Karen. Let me take a look at you. Do you know where you are?
How is she?
She seems to be okay. She has a small bump on the side of her head. I don't know what she hit it on. She doesn't seem to remember what happened. Nothing else seems to be hurt.
All right, well, let's get her back to bed. You get her vitals and I'll call the doctor. Keep an eye on her and don't let her get out of bed again. Ruth, take her vitals and do neurochecks every half hour for a couple of hours and keep me posted.
When there is a change in the client's condition, the nurse must reassess the situation to determine if the abilities of the assistant are still compatible to the client's needs. In this situation, they weren't. It is also critical to verify the assistant's understanding of the directions. Karen did not validate that Ruth understood the importance of observing the client, nor did she provide any direction regarding reportable conditions.
Assignments are not written in stone. They can and should be changed based on the dynamics of the client's condition. Continuity of care should never supersede client safety. Here are some situations that indicate that the delegation should be reconsidered. 1. The client's condition has changed. 2. There is evidence that the work is not being completed as outlined. 3. The assistant fails to report back to you. Or 4. The assistant is given additional tasks to complete.
Jenny, Mrs. Campbell's complaining of a headache.
Did you tell Karen?
I went looking for her, but she's all tied up with the new admission. She told me to find you.
Well, I'm just as busy as she is. All right. Are her vital signs okay? What about her neurochecks?
She seems fine, just a little tired and worn out from all the commotion. But her pupils are equal, they react to light. I think she's just tired.
Well, I'm busy right now. Grace is giving meds on your patient. Go ask Grace to give her something for pain.
I couldn't tell her I was losing ground. I was slipping away slowly but surely. My pupils were reacting but sluggishly. My pulse pressure was widening. Unfortunately, no one picked up on it. The nursing assistant just didn't have the knowledge base or the experience to see the subtle changes in my condition. She couldn't put the pieces of the puzzle together to see the big picture. Oh, I was in trouble, and I needed help.
The final step in the delegation process is evaluation. What went right, what went wrong. Delegation decisions and client outcomes must be continually evaluated. This includes determining how the process went and whether the desired client outcomes were achieved. If not, then why not? It also includes an evaluation of the delegation decision-making process and the delegator-assistant relationship. Provide feedback to the individual regarding his or her performance. Review with the assistant what went right and what went wrong with both the task and the process. Discuss how the process could have changed to improve the outcome.
What happened here?
Well, Mrs. C fell about 5 hours ago. We found her on the floor in the bathroom. She must have tried to get up by herself. She had a small bump on the side of her head, but she seemed okay. She was alert and oriented at the time.
Okay, did you notify her doctor?
Yes, I called and left a message with his service, and I didn't think it was an emergency, but I called her family
She
too.
complained of a headache around 6 p.m. She had something for pain then.
Okay, let me see her chart. And when did you say she fell?
Around 4 p.m.
Okay. Where are her vitals? The last entry says 6 p.m. That's 3 hours ago.
You said take them every half hour, and I did. And when she got her pain meds, she wanted to rest. So I checked in on her, but she seemed to be asleep. I wasn't going to wake her to take them. Then I got busy with Mr. Ringwald, and I didn't get back. I just never got back.
I think we have a serious problem here. You better call her doctor. Stat. Can I see your stethoscope?
It happened so fast. By the time I got help, the bleeding in my brain had already done too much damage. I never regained consciousness.
This tragic client outcome was preventable, and so were the professional outcomes. Both the RN and LPN had their licenses disciplined. The nursing assistant was terminated. The lawsuit is still pending. Desired outcomes of the delegation process include protection of client safety, achievement of desired client outcomes, reduction of healthcare cost, access to appropriate levels of healthcare, delineation of the spectrum of accountability for nursing care, and decreased nursing liability. We can see that in the case of Mrs. Campbell, many of these outcomes were not achieved. In fact, just the opposite occurred. The delegation process was in jeopardy from the start. However, there were numerous points at which the downward spiral could have been halted. Reestablishing the delegation process at any one of these points could have averted this disaster.
The inability to delegate effectively has led to the downfall of many leaders, from presidents to charge nurses. Ineffective delegation can be risky business. You wouldn't jeopardize your client and yourself by performing a clinical procedure without the necessary skills. The same holds true for delegation. The steps of the delegation process become your professional safety net when working through others.
Delegation in nursing is an art and a science. It is an art because it requires solid nursing judgment. It is a science because there are specific steps to be followed that ensure positive outcomes. Applying the science while practicing the art of delegation will serve the nurse's clients, the employer, the profession, and the community at large who depend upon the nurse to administer safe, effective nursing care.